in Colorado. My name is Lou Ann Williams, and I'm the Executive Director at Colorado Neurological Institute. We are the co-sponsors today with Colorado Rural Health, and my associate, Lou Ann Wilroy. I want to just give you a little background about how this came together. Lou Ann and I meet occasionally, usually over a Starbucks, to commiserate and often talk about rural health and telehealth and what's going on in telemedicine in the state, and to just kind of catch each other up, because there was really no one place where we could go to find out what is everybody doing in Colorado. And it seems like every time we'd meet, we'd find out somebody else was doing something that the other didn't know about. So we decided it was really time to have a conference like this to pull all of us together. And we figured, well, why not now and why not us? So we went to our good friend Susan Hill at Caring for Colorado, who gave us an initial lead grant to sponsor and underwrite this event today so that we could keep the registration costs low, and to give Lou Ann and I the confidence that we could put this together and be able to have the funding to do that. So I want to thank Caring for Colorado and Susan Hill. And then Colorado Health Foundation followed with a grant also so that we could put this together for you this morning. CNI's interest in telemedicine started about 3 years ago when we had a brilliant young neurologist who's stroke trained came to us from California, and he had been involved in a telestroke program there and came to Colorado and said, you know, I really want to do this here. I want to do this at CNI. So we went to the state of Colorado, got a grant in a very naive way, and those of you that are doing this will understand this. We went and got an equipment grant to do stroke health telemedicine and put cameras out in 6 rural hospitals around the state. Well, little did we know that we needed a little bit more than just the equipment to get this done. So we scrambled. Our board was very committed to it, and we now have 11 units around the state and are providing stroke acute care to hospitals around the state. So we're very happy to do that. I want to thank all of our exhibitors and to all of you for sticking with us in this Colorado weather. I'm hoping that we're not losing anybody to the golf courses today. Isn't that amazing? We go from a blizzard to 80-degree weather in the course of a few weeks. So I'd like to thank you all for being here, and it's my pleasure to introduce my counterpart, Lou Ann Wilroy, and everybody have a great day.
Thanks, Lou Ann. I appreciate the introduction. I want to take a minute before we get started to recognize a few people that were instrumental in putting on this Telehealth Symposium. When Lou Ann and I started talking about developing an event like this today, we realized that we needed to bring in some expertise from across the state. And we tried to put together a group of folks who have expertise in telehealth, and we ended up with a great mix of different people from diverse backgrounds and different industries that are involved in telehealth, and formed an advisory committee. And the advisory committee helped us to design the agenda and to work out the details and select speakers and topics for today. So I want to recognize the advisory committee and have you stand. The advisory committee members have a blue ribbon on their name tags. Could you all stand, please, just so we can recognize you for your help with this? Thank you. And I'd also like to thank our exhibitors. If you have a few minutes today, we are going to have some breaks and some time for you to step out into the main area and visit our exhibitors. Some of them have come from out of state, and they were so generous in supporting our event today. So please take a moment to visit them and talk to them and learn about what they have to offer. And Lou Ann thanked our sponsors, the Colorado Health Foundation and Caring for Colorado. The Colorado Hospital Association also is a sponsor and provided funding to support the event today, so I want to thank them as well. And I want to thank all of you for coming in, especially those of you who came in from out of state and from across rural Colorado. It's a long way to travel from Grand Junction and from the South Central Valley and the far eastern plains. And so I just thank all of you for traveling in today for this meeting. We're so excited to have you here. I'm with the Colorado Rural Health Center, and we are the State Office of Rural Health. For those of you who aren't familiar with our organization, we've been around for about 18 years, and every state has a State Office of Rural Health. In Colorado, we're one of only 3 state offices of rural health in the country that is set up as a nonprofit. This year, I'm extremely grateful for that we're not a state agency, I can tell you. The other state offices of rural health actually are part of state government. Usually they're housed in the state health department. So we are fortunate enough to have the flexibility as a nonprofit to apply for funding and participate in different programs and take advantage of resources that we wouldn't be able to if we were a state agency, although we work very closely with state agencies. So that's a little bit about how we're structured. Our purpose is to help rural communities address their healthcare issues. We have a staff of about 20 employees, and we have a number of programs and services that we administer across the state to help address rural health issues. We recruit health professionals to work in rural and underserved areas. We have grant programs that we administer. We work with small rural hospitals and clinics across the state, providing technical assistance and different resources, education, training, assistance with billing and reimbursement and compliance, and all types of different issues. We are really interested in telehealth at the Rural Health Center because we believe that technology is the key to providing the healthcare services that we need across our state in our underserved communities that don't have access to comprehensive, affordable healthcare services. So advancing technology is very important to us, and telehealth is very important to us. We feel that Colorado should be a leader in this industry. We've learned about other states and what they're doing in telehealth, and you're going to hear some amazing information today from folks from out of state who are going to highlight some best practices and success stories about what's going on with programs in telehealth in other states. I want Colorado to be invited to speak at national meetings to give presentations on best practices and success stories about what's going on with telehealth in Colorado, and I want us to do that soon. I want us to be on the forefront and be a leader in this country in telehealth and providing remote healthcare services across our state, and there's no reason why we can't get there. In our state, as Luann mentioned, we don't really have a centralized agency or focal point to be able to gather information about what's going on in telehealth. And my hope is, and the planning committee's hope was, that somehow today would move us forward in that direction to find a way to have some kind of a statewide, unified group that can help do that, bring together all the information and all the expertise that we have available in our state and resources to address this issue and expand it in our state. It's very important that we have a combination of different types of professionals and different types of industries and all different kinds of folks involved with this effort. And I'm very excited to see that we have a diverse mix in the room today. It's important that we have broadband providers as part of this process. And we do have a few in the room today. Very important, most important that we have funders involved in advancing telehealth. And we have some great interest and some great healthcare partners that are funders in our state. And it's wonderful to have their interest. We need the technology industry as part of this. We need our large urban health systems to be involved. And I really appreciate those of you in the room from our large urban systems who are here today, Health One, Centura, thank you so much. And we need, of course, our rural health facilities and providers and rural community members to be a part of this. County government, city government, anyone who's involved in healthcare services needs to be a part of this process. And lastly, but one of the most important components are our payers, our insurance companies. Just to tell you a little story, when we started planning this event, we wanted to have a payer panel, and we wanted to hear from the large payers, the large insurance companies in our state about their plans to reimburse providers for telehealth services, to provide consultation. And almost all of them agreed to serve on the panel when we started making our plans, but little by little they backed out, one by one. And we now have Medicare and Medicaid on our panel. So I want to thank Lila Nichols and Eric Wolf for serving on our payer panel. Our public insurance companies are going to be talking about their payment structure and how they reimburse for telehealth services. The large private insurance companies are not participating in the panel, and one can only assume that the reason for that is that they're just not ready to go there. And I know they're all working toward it, but the time is it's just not the right time to bring that out in the open, and we've got to get there. Before telehealth is ever going to be mainstream, we've got to be able to pay our providers for providing the service. So those are some of the objectives that we have that we want to talk about today and try to move in that direction. So we hope today will help our state move toward making telehealth mainstream, and all of you are going to be involved in the discussion and this decision making by the end of the day. In front of you, you'll see that you have an electronic polling device, a little device that looks like a calculator. And through those devices, we're going to have you give us your feedback about the issues that we're going to be talking about today. So I want to turn the microphone over to Chris Adams, who's with the Adams Group. And Chris is going to be facilitating the day today and leading us through our discussion about all of these different topics. So Chris, take it over.